Our vascular system is a workhorse for our entire body, which is why it's so important to take really good care of it. Joining us now to talk about the best way to do that is Dr. Irfan Imami and Dr. Moccia with a combined 50+ years of experience here at the Orlando Health Heart and Vascular Institute. Welcome, thanks for being here.
Well, thanks for having both of us.
Vascular system, it does all kinds of things. It transports oxygen, it gets rid of waste, and you are vascular surgeons. So what does your job entail?
Absolutely. We're vascular surgeons. We're specialized surgeons that just work on blood vessels all over the body other than the heart or the brain. Those two are things we don't do. Every other blood vessel we manage.
So sometimes it's something that's serious that can affect your heart and potentially give you a heart attack. Dr. Moccia, sometimes it's something like vascular issues in the lower legs, varicose veins.
We can have varicose veins. Patients will have large bulging veins in their legs that cause pain, heaviness, fatigability. We take care of venous disorders too. The important disorders that can be life-threatening, as you previously mentioned, are patients with carotid disease. Carotid disease can lead to strokes, which are a fair number of strokes across the country each year in our country.
You have a unique relationship. You actually do surgeries together.
Sometimes if it's more complex, it's just a lot easier and safer for the patient.
So normally a leg bypass will take an hour or so if you do it by yourself. We do it in 45 minutes because one surgeon is operating on one blood vessel while the other surgeon is operating on the other blood vessel, and we can hook them up almost at the same time. And then when we're done, we both close our incisions. And that patient is under general anesthesia for a lot less time, which is much better for the patient.
What's ahead for vascular health care? What do you see in the future?
I think it's going more towards minimally invasive surgery. Technology continues to improve, get better and better. So we can get people as outpatient, come in the morning, have an outpatient procedure done, and let them go home. And they'll see an improvement in their symptoms right away with minimally invasive endovascular methods.
And Dr. Moccia, you have something very unique here. You have what's known as a hybrid operating room.
That is correct.
Tell us a little bit about what that is.
A hybrid operating room allows us to do both radiological imaging and open surgical procedures at the same time. And I'll give you a brief example of a patient that I'm operating on this week. They have blockages in the groin area. The patient also has blockage in their pelvis in a different artery. That blockage is going to be treated with a stent, so to fix that all at the same time. This way they don't have to come back for a second procedure.
Dr. Imami, Dr. Moccia, appreciate your time today, and if you would like more information, you can visit orlandohealth.com/heart.